My name's Iestyn Jones. I'm General Manager with Welsh Lamb and Beef Producers, a farming cooperative of over 7,000 sheep and beef farmers in Wales. We're part of the Arwain DGC project, with our main remit being collecting data on the antibiotic usage on Welsh sheep and beef and dairy farms. And this will be done by working very closely with the veterinary profession in Wales. We're here at Camlas Farm Vets, one of the first adopters really.
So we've been doing the health and welfare review forms for a while now. I'm doing the calculations in-house, which have been great because any antibiotic calculation means that we know what the main problems on the farm are, what we need to focus on in the health and welfare review and the health plan, and to benchmark farms against other farms. And having it standardised, as in with the Welsh Lamb and Beef website and the calculator, means that we know that we're doing it the same way as everybody else is doing it, and we can benchmark against other farms and other areas in Wales.
Very important really that the industry has got a standardised way of doing this. We've been looking at these mechanisms now for a couple of years. One of the advantages we will have from having this system is that we can benchmark on a practice level, which is something that will involve the vet and the farmer doing this work, but also we can have anonymised data to look at regional aspects across the country and national data. We're clearly seeing this need. We all know the threat around antimicrobial resistance. It's a worldwide issue, and we need to demonstrate with data and evidence that our farmers are doing things responsibly, and when we need to use these products, that is also justified really, and hence why we at WLBP have gone down the route of engaging this process with the vet farmer, which I think is really crucial.
I think apart from all the other benefits which you said, benchmarking, there's a big benefit to the farmer to doing an antimicrobial audit and calculation, because it means that they know exactly where their usage is going, and they don't want to be using antibiotics, any farmers, so it's just a really good way of focusing people's efforts on which diseases need tackling first. So I'm here in the surgery, and this is the calculator that we're using with the Welsh Lamb and Beef Producers website now for our antimicrobial calculations. So the first page we come to, just to quickly run through it, we assign our enterprises here, so sheep, beef and dairy, so that we're separating the different enterprises out. Assigning animals with this tab, so that we can assign which animals are beef or dairy animals. Then we're on the microbial records here, where we use our antimicrobial sales data to calculate how much of each antibiotic we've sold to this particular farmer in a 12-month period. And then we run the report here, and the website produces a report for us. So you get a breakdown of the drugs that we've sold in a 12-month period and the 12-month period before, and it categorises the drugs into critically important antibiotics versus non-critically important antibiotics. Hopefully that should be 0 or very low critically important antibiotic usage. The bit that calculates the usage on a herd or flock level is the last bit, where total antibiotic usage is in this bar here, and it compares it to the 12 months before, so that you've got a good comparison to see where the antibiotic usage on that particular farm is going.
So Iolo, as far as you're concerned as a practice, what are the benefits of this do you see within your practice, or have to date seen about it?
So it's focusing us on which drugs we use for a start, so we're using as many appropriate drugs in the lowest risk category of antibiotics, and reserving the second line of antibiotics for when they're really needed, and using more cultures and sensitivities to find out which drugs we need and when, because it's really imperative to our farm animals that we keep these antibiotics, because they're imperative when we do get a problem, and there is inevitably problems in any system. So we're focusing on reducing the problems to start with by using other methods like vaccination and environmental management,